Welcome back to Hot Flashes and Cool Topics. Today, you guys, I'm pinching myself because Dr. Jennifer Ashton is on the show. Welcome to Hot Flashes and Cool Topics.
Thank you, Colleen. Thanks so much for having me.
Oh, we're just thrilled to have you. You have been such a wonderful representation of this time of life, and anyone who is not following you on Instagram needs to right now. Um, I wanted to start with the experiment that you have been doing the last 6 months for health and wellness. I have watched you. Just watching you do the push-ups, I'm like, oh my gosh, I could not do that. But how did that get started and why did you decide to do it?
First of all, I challenge or will push back on that. You don't know that you can't do that. I thought I couldn't do it either, but it was something that started just as something I wanted to do for myself. I had just stepped away from a 14-year position at ABC News where I was waking up every single morning at 4 or 5 o'clock in the morning to go to work. And I thought, okay, I'm going to have a little bit of a different schedule, which I was excited about. Let's see. I wanted to do this experiment, and I deliberately, in my mind, to myself, called it an experiment where I would try over a 6 month period of time to get into the best health, wellness, fitness that I could achieve out of a sense of curiosity. I'm 55. I knew I wasn't in my best fitness level. And it's not like I was, doing nothing, but I just felt, my back always hurt. If I was at a party, I'm not joking. This is embarrassing to admit, but if I was at a party where I would be dancing with my husband or, one of my kids or a friend, I would literally be out of breath in one song. So I had lost my party fitness. I wanted to look, 55 years of age in menopause, skin starts to sag. Skin sagging is one thing, muscle sagging is something else. And so I said, okay, I'm going to try this 6 month experiment. I announced it on my Instagram, DRJ Ashton. Thank you, by the way, for following it. And there were over 1 million views, and people became really interested, supportive, inspired, obsessed with it. And I've been kind of updating people along the way. And I have learned so much. I partnered with an incredible trainer, Corey Rowe, and we are bringing a lot of this information to our followers in a way that literally I have women in their 70s who are DMing me on Instagram saying, I want to start to do this. How do I do it? So we're putting it all out for people in the next couple of months, but people can follow it along on my Instagram and in my newsletter, by the way, which is free every
Agenda.
week. Join
Yes,
Agenda,
agenda. Love that. And
Agenda
we'll
like
get
Jennifer. But it was all it was really all about curiosity. And I think there's so much information and misinformation out there that I call it noise. There's just a lot of noise in the wellness space. And it's nice to see someone who's, kind of says like, all right, look, I couldn't do this before, but now I can. This is what's possible. And that sense of community and the information that I've been sharing with people, really is resonating. So it's been fun. It's been rewarding. It's been funny. And it's really been incredible.
and of course you picked your 6th month to be the holidays, the hardest month
I
of the
know.
year. Like,
I
why?
know. I
Not
didn't think about that.
January.
I know.
With you going through this 6 month journey, so many women, we've been doing this podcast 5 years. We have talked to so many experts, but women are just not getting out there and advocating for their own health and wellness. And I think you doing so and being a great representation is really going to help a lot of women. Why do you think it is still so hard for us to be our own best medical advocates?
Uh, that's the big question. That's the $1 million question. I don't have an answer for it. I can only tell you again, and full disclosure, embarrassing admission that I've even been guilty of that when I'm the patient, right?
It's
So
true. Right.
If you have a doctor who's double board certified and that can happen to me, it can happen to anyone. And I think, part of it is societal, part of it is psychological, part of it is cultural, part of it is generational. Who knows? There's a zillion reasons for it. All I know is that, I've been in practice almost 20 years. I've spoken to millions of women in my role as former chief medical correspondent at ABC News, and other networks before then. I've had thousands of patients, and we are just generally conditioned to not prioritize our own health, to even question things that we're feeling or experiencing. And then everything can kind of domino effect suffer from that point on. And look, I was guilty of this, Colleen. Literally, by the way, what I'm about to say, I've never said before publicly. So
Ooh,
yeah,
okay.
I'm
I got a
giving you
scoop.
a nugget. When I went through menopause, which was in the last 5 years, I literally had every symptom head to toe that you have read about, heard about, learned about, or whatever. And I did not recognize that they were symptoms of perimenopause and menopause
Oh
until
no.
like a year ago. And I'm a board certified OBGYN. So I think that goes back to your original question. This is just something that, what do we say? Oh, well, I'm 50, so my back hurts, or I'm 50, so my hair is breaking off, or I'm 50, so I'm having a hot flash. Or we say, I'm too busy, I don't have time to deal with this. And I don't want to talk about it because there's been this ridiculous stigma where it's been like whispered about for generations. And, if it can happen to me, it can happen to anyone. I mean, it's got to change. And thank goodness menopause is having a moment.
Oh yes. Oh yes. Menopause is having a big moment. And when we started this just in 2019, nobody was talking about menopause. And it was like, oh, but there were so many advocates and experts that wanted to get the word out. And it was great to see this trajectory just kind of explode. But
Yeah.
with that comes a lot of misinformation. A lot of people are saying, take this, take that. How can women judge? This is why I love your joining with Astellas to talk about Veozah, because not every woman can take an HRT, but they're still getting hot flashes. Can you talk a little bit about your relationship with them?
Yeah. So first of all, I have to start with another personal kind of inspiration or motivation. And it was why I was so excited and felt so compelled to partner with Astellas to talk about Veozah. I have a 25-year-old daughter who's obviously not in menopause, but has been told by her gynecologist, her doctors, that hormones of any kind are never an option for her because of a medical reason. I immediately thought, she's 25, I'm 55, as I started to go into menopause, I thought, what's my daughter going to do 30 years from now when she's in menopause? What are the options that she's going to have presented to her? And from there, it was literally the next door neighbor response to realize, and again, from what I do as a medical communicator, as a doctor, as a friend, as a woman myself, people think that here's your options: hormones or suffer. That's it. And even some healthcare professionals think that. But certainly a lot of women in the lay public, that is what they've been told, and they don't know about other options. And so I felt personally compelled, as the mother of someone for whom any kind of hormones will never be an option, to say, look, we always have to go back to the premise, the classic proper way of medical management and treatment, which is to present all options, risks, benefits, and alternatives. And when you talk about suffering from moderate to severe VMS, vasomotor symptoms, hot flashes and night sweats, whatever you want to use to refer to them, there are hormonal options, there are non-hormonal options that are by prescription, There's other cognitive behavioral therapy has been studied, but women are usually given one option and that's it. And I just felt so strongly, Astellas is doing such a good job with, I'm sure you've seen or heard about the new platform, mycoolermoments.com. It's
Mhm.
kind of just a great education, discussion, community platform that women can get informed, figure out what to bring to their healthcare provider to discuss if Veozah or any other management option is right for them. And that is at the beginning and end of the day what I feel so strongly about as a doctor and as a woman.
Can you talk a little bit about the updates they've made with regards to the liver testing for women? Because I know that's
Yeah.
a concern for some patients.
Yeah. So, first of all, big picture, the macro view, anytime you take anything, whether it's over the counter, prescription, supplement, even you could go so far as to think test, treatment, anything in medicine, you always have to ask, what are the risks? What are the benefits? Right. And it's not just what are the risks of the treatment or the medication, it's what are the risks of the medication or the treatment, and what are the risks of not taking the medication. And then you go ask the same question with benefits. What are the benefits of the medication? What are the benefits of not taking the medication? So there's really 4 questions that people should ask. Always. Everything has a risk, as we know, over the counter, supplements, prescription, medication. Um, with clinical studies, it has been detected that there could be a change in liver blood tests in women who are taking Veozah. So the FDA, after getting one report of a patient who had an elevation of her liver blood test, which gradually went back to normal after she discontinued Veozah, added that alert in terms of a recommendation guideline for prescribers. So any woman who would be starting Veozah would have her liver blood test checked before treatment, every month for the first 3 months of treatment, and then at 6 and 9 months. And every woman is counseled about what the signs of possible liver issues could be. And this should go on, and I want to be crystal clear, with any prescription that you are ever given for any reason. You should always ask, what are the risks? How would I know if I have a side effect? How common is that side effect? What do I do if I have it? I mean, this is just basic medical practice 101. So as there are with many other medications, that's something, if a woman has pre-existing cirrhosis or liver problems or kidney problems, or takes a medication called a CYP1A2 inhibitor, they should not take Veozah. But this is why medicine is not cookie cutter, robotic. This is why a woman should talk to her healthcare provider or doctor, pros, cons, risks, benefits, and find out if this or any other option is right for her.
That's so important to know and to write down because we always say to women, have your notes. You get 15 minutes maybe with your doctor. And it's so important that you know your family history, you know your medical history. A lot of
Mhm.
women can't answer the questions of do you have cancer in your
Right.
family? Do you have anything like that? What would you say are some of the most important questions women can ask when they walk into their doctor's office about menopause
Well, the
if they're
first
struggling?
question, yeah, the first question, and I think this isn't necessarily a question, but it's an awareness that I think every person should know, including men, because most men have at least one woman they care about in their life on some level, is that symptoms of menopause can start in a woman's mid-30s, as you know, mid-30s.
Lucky us.
And so it's not, oh, you have to be 50 or you have to be 60 or you have to be 55. There's no like line in the sand where a woman is quote unquote too young for it. And so that woman needs to know before she walks into her doctor or healthcare provider's office that she knows her body best. And so anything that you notice that deviates from the norm, you should be kind of like your medical detective or your medical reporter or journalist and say as much as you can about that observation, that symptom or that sign as you can. When did it start? How bad is it? How often do you notice it? What makes it better? What makes it worse? How much of a problem is it in your life? I would recommend that women don't follow what I did, which is minimize, ignore, deny, say, no, 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 no. That's, it is 2024, almost 2025. We should not be doing that. Um, and so I think it starts with just recognizing that you are the expert in your own body. So when you go into your doctor's office, and it doesn't have to be for your annual exam, yes, you can make an appointment and say, I would like to come in and talk about things that I'm experiencing that I think may be related to perimenopause or menopause, and then find out what are my treatment options. I used to refer to this like a menu of options, literally, like you can choose one thing from column A or one thing from
Like a
column.
Chinese menu.
Yeah, literally. And so, I think women should ask their provider, and this is where the patient-doctor relationship really should be a two-way street, right? It's not a dictatorship.
Right.
It is definitely should not be that. So in some cases, the patient could actually be bringing information to the provider or doctor that he or she might not have heard before. Veozah is a perfect example of that, right? So if you say to your doctor, I heard there's a 100% hormone-free option for moderate to severe hot flashes and night sweats, and your doctor says, I haven't heard of that. That good doctor, that doesn't mean, oh my God, find a new doctor. That good doctor should then educate herself or himself and say, I haven't looked into that yet, but guess what? I'm going to, and I'm going to get back to you. And then, you can move on and figure out whether that's an option for you. I think always having that dialogue is so important. And when you hear a doctor say, I don't know, it doesn't mean you have a bad doctor. In my opinion, it actually means you have a good doctor. And they're open and honest and willing to learn. And, we learn every single day in medicine and science, or at least we should.
And there really has been, we have found that a lot of doctors just simply are not educated on menopause and the support system. It's so new, the conversation, but yet in medical school, they weren't given the hours that they needed to really educate themselves.
Correct. Which is, when you think about it, there are three hormonal stages in a woman's life that most women will go through, not all. Puberty, every woman goes through. Pregnancy, most women go through, not all. Menopause, my own husband, I'll tell you the two comments from men in my family that I had spoken to me literally in the last 3 months. My husband said to me, does every woman go through menopause? And I said, by the way, he's a Harvard graduate. So this has nothing to do with education level.
Right,
Okay.
exactly. He's
I
a
said,
man. He doesn't go through it.
I said, only the ones who are alive, honey. Only the ones who are alive. So I mean, I go at things most of the time with a sense of humor because we have to laugh it through life. But I do, all kidding aside, consider menopause to be a privilege reserved only for the living, right? 100 years ago, when women didn't live to 50, maybe you didn't have to talk so much about menopause. But today, it could literally be the halfway point in our lives, right? So I said, only the ones who are alive. And so I taught my husband something. And then my son, who's a Columbia graduate and has grown up in a medical family with a mother who's a gynecologist, said to me, and I quote, Mom, do you have menopause? And I said,
Oh, no.
Cutie, it's not a disease, by the way. It is not a disease. And yes, I'm 55. So yes, I am in menopause. And my son's 26. So I felt good about that because I educated two men at very different ages about something that should be so commonly known by everyone that we have to make up for all the lost ground in lack of education and awareness. And I really think that platforms like My Cooler Moments do that because there's so much information there.
Can we talk about the platform? So, what can
Yeah.
women expect to see when they go on My Cooler Moments?
Well, first of all, a real conversation with a real woman who's gone through menopause, who talks about her experience with moderate to severe hot flashes and night sweats, through her career, through her life as a mom. For her, Veozah was the answer for her, but she really talked about the whole process of what she went through with her doctor and how the menopause experience and symptoms affected her. There's a lot of information about menopause, hot flashes, and night sweats in general. There's great information there about how women of different racial and ethnic groups experience hot flashes and night sweats differently, which a lot of people don't know. There's a quiz on there because you know I love a quiz. It brings me right back to school. There's some tips about how women can talk about menopause with their doctor or healthcare provider. There's savings cost information specifically about Veozah if they choose that as an option in terms of managing their symptoms of menopause, in terms of hot flashes and night sweats. It's a great resource for education, community, just so that women have a place that they can go, to really feel heard and empowered, which I think is great.
And I think that's important too. We'll have the link in the show notes for Astellas and for Cooler Moments. But just talking about the cost, because some women are concerned about the cost and it may not be covered by insurance. So the fact that they're offering some support that might make it more cost effective is a great resource for women to have because they wouldn't even know that.
That's number one. Number two, I mean, as I'm sure every listener of yours has heard from their own provider, reimbursement coverage differs literally person to person based on their insurance information. And some tests, some treatments, this is why most doctors find it so kind of challenging and time consuming to deal with a lot of different insurance companies, is some require prior authorization. So someone will have to say, well, I tried this on a patient and it didn't work, so that's why we're trying this. That's not the case only for managing hot flashes and night sweats. That can be the case for a lot of other tests, treatments, whatever. But they have a whole kind of access information there about cost and prior authorization, all the insurance information that is can be very kind of intimidating for people.
Exactly. And a lot of women don't know where to start. So that's a
Right.
great starting point because they're like, where can I even get the information on this? So, again, we'll have that in the show notes. And another great platform for information is Agenda, which you have started. Now, you were,
Thank you.
with Good Morning America and NBC News for a long time. Were they related, the decision to leave and to start Agenda?
No, well, related slightly, number one, interest in terms of timing. But, for me, I think you mentioned that you started your podcast before the pandemic.
Yeah.
For me, a lot of the decision to focus 100% of my bandwidth on women's health and weight and nutrition, which is what I'm board certified in, I kind of see as an unexpected consequence of the pandemic as well, because Colleen, I learned more about COVID than most infectious disease doctors because I had to talk about it 16 hours a day. And I was speaking to people at the NIH and the CDC and the FDA and, the White House, and it was nonstop. And what I realized is, and I was very honest with my amazing bosses at the network about this. Can I talk about any topic in health? Sure. In fact, that was my job. And I loved that for 14, 16, 18 years at a combination of networks because it kept me current in medical headlines that the average doctor unfortunately doesn't have time to stay current in because they're too busy with constant patient care and all of the things, the busy work that goes along with that. It was my job to be current with medical headlines. But after covering COVID, I said, listen, we're good now. We're out of it. I really just want to focus on OBGYN, obesity medicine, and nutrition issues. And the way I decided to do that was by launching this free weekly newsletter called Agenda, Join Agenda. And when I had almost 200,000 subscribers who were saying to me, I look forward to this every Wednesday. It's such good information. It was so, just kind of reinforced to me that there is a need, there is an interest. women are particularly passionate about not just reading something, but understanding the different perspectives that go along with it. And I think that's what we do really, really well. So it's continuing to grow, and I just have been loving it.
And we have been loving it too. It's
Thank
got
you.
so many resources and so much information because it talks about women's health, not just menopause, but not just obesity, but women's health. And along the lines of women's health when it comes to weight, there's so much being said about Wegovy and Ozempic. But what about women's muscle mass? Is that a concern when they're taking these medications that they might be losing more? Because we lose muscle as we get older to begin with. How concerned should they be about that?
Well, first of all, every woman and every man should be concerned about losing muscle mass, which actually starts, get ready, drum roll, at really around the age of 40. Okay.
Great.
So, yeah, slow loss of muscle mass as men and women age. Part of that has to do with declining testosterone levels, but it's not that simple. So, age-related sarcopenia, which is the medical term for losing muscle mass, is a real issue for everyone. And it's one of the areas, the other one being bone health and bone density and osteoporosis, where being skinny or thin, or I don't care what word you want to use, is actually not good for you, right? Because you want to put some of that positive gravitational force on your muscles, on your bones, just by being vertical and walking on the planet with gravity, right? So that's why weight-bearing exercise is important. That's why eating a diet that's high enough in protein and lifting weights is important. When you talk about women, though, particularly women who enter perimenopause and then menopause, frailty affects longevity, number one, and frailty also affects health span. So you're looking at the lower end of people in terms of their weight. You mentioned all the GLP-1 drugs, which you literally can't open your eyes today and not hear or read a headline about. They are not new, despite the fact that people think they are new. The first GLP-1 drug was FDA approved for the management of type 2 diabetes in the United States in 2005. All right. So we have 2 decades of information about how these drugs work, their risks and benefits, their pros and cons. The headline, like so many other headlines in medicine and health about losing too much muscle with these drugs, it's as usual, it's the deep dive behind that headline where it's really important for people to get the right information, which is that if you're talking about someone with the condition of obesity or with the condition of overweight, and believe it or not, that's what it's called. It's not being overweight, it's a condition of overweight. Don't ask me
Okay.
who grammatically picked that one, but it is. They have a larger percentage of muscle mass, but just based on their weight, but it is dysfunctional / pathologic muscle. Okay. So when they lose more muscle with their weight loss, when they're on a GLP-1 drug, not all of that lost muscle is well-functioning, healthy muscle, right? So this gets us into this arena, which I talk about a lot in my newsletter, but whether it's talking about GLP-1s or whether it's talking about Veozah or any other medication, this is where thinking like a doctor is so important. It's not what's the risk of the drug versus don't take the drug. It's what's the risk of the drug and what's the risk of a person with obesity not taking the drug and continuing to be obese. Significant, right? So though that's not a question mark. We know conclusively what those risks are. So if there's a treatment that will result in a significant amount of weight loss, which these drugs have been shown to do, okay, in conjunction with a healthy lifestyle and good behavioral modifications, that is worth the risk of a person losing 45 to 50% of their lost weight from muscle, right? And especially when you can say, well, then what do you do about that? Well, if you know that you're on a medication that has that risk, are there things you can do in your behavior that can kind of moderate or mitigate that risk? And the answer is yes, there are. Eat a diet that's high in healthy protein and lift weights so that as you're losing weight, if you're someone with a BMI that falls in the obesity range, you're actually building new healthy functional muscle. And so the reason that most people haven't heard that is because I just gave you a 90-second answer. And when you hear a headline, people think like clickbait, one little question, it's as simple as that. And people have maybe a 5-second attention span to hear something that's yes or no, black or white. Medicine and science are rarely that simple. So that's a perfect example. I'm so glad you asked about that.
And I think this goes back to you saying women need to be their own best advocates. They need to do the research, have their questions for doctors. And you've been so generous with your time. I just have one more question. For those of us in postmenopause, and are happily so because we seem to be just living a wonderful life postmenopause, but I think some of our listeners think the day you're done postmenopause, you have no more hot flashes, no more symptoms. Can Veozah be prescribed postmenopausally for postmenopausal women?
First of all, you're probably not going to be surprised when you hear me say that every woman should talk to their doctor and their healthcare provider. You're very kind with calling me, the doctor for the country, but everyone should talk about that with their
True.
own doctor. There's a lot of controversy in the world of menopause medicine right now about is there a time window for certain types of treatment and management? Remember that Veozah is FDA approved to treat moderate to severe vasomotor symptoms, hot flashes and night sweats due to menopause. So if a woman is having those symptoms, she should have that conversation with her doctor. There's it's not one size fits all. You can't say to a woman, well, oh, sorry, you're 55 and a half. Like the door is closed. My grandmother would say, well, then open a window. So, there's such a wide variety in how long symptoms can last, particularly hot flashes and night sweats can last for a decade in Black women, for example. So there's certainly no line in the sand where any informed, educated healthcare professional or doctor should say, you're over this line if you're having those symptoms. So absolutely, it keeps going back to education, awareness, and having that discussion with a woman's doctor.
Well, we appreciate so much all of the answers that you gave me to the questions because we know it's going to help our listeners. And also, we would love for you to come back and talk about your results from your experiment,
Okay, you got it.
what you're taking with you and what you're going to pleasantly forget.
That's right.
Doctor,
Anytime, anytime.
thank you, Dr. Ashton. I appreciate it so much.
Thanks, Colleen.